Hello. Hi, Ravan. Hello.
Hello, Samina. Hello, Dr. Soha. So we will start in a bit once we will have more attendees over here, maybe at 5 or 5:10. I'll give you a call before starting, inshallah. Assalamu alaikum wa rahmatullahi wa barakatuh. Hello, everyone, and thank you so much for joining us today. In collaboration with Zuleika Hospital, today we are going to give a webinar to raise awareness about breast cancer and to highlight the importance of early detection. My name is Rawand, and I'm from Friends of Cancer Patients, and we're honored today to have Dr. Suha Abdul Baqi to give the lecture. We will start now, but please, I would like just to highlight 2 points. First of all, if you have any questions, just leave it in the chat box and we will answer it, or Dr. Suha will answer it at the end of the lecture. And then also we will be giving certificates for the attendees. I'll leave a link in the chat box. You just have to enter, leave your name and email, and then the certificate will be shared with you directly and you receive it in your inbox. Over to you, Dr. Suha. We can start now. Thank you. Doctor, please, if you can just unmute.
Good afternoon, everyone. Thank you so much for Friends of Cancer Patients for inviting me today, actually to raise the awareness of breast cancer, to raise awareness of all types of cancer, and especially breast cancer. I'm Dr. Suha Abdul Lima, consultant medical oncologist at Zuleika Hospital, Dubai, and assistant professor of clinical oncology, Faculty of Medicine, Cairo University, Egypt. First, I will define cancer. What is the meaning of cancer? Cancer is abnormal, uncontrolled growth of cells that will form a tumor. What is the meaning of this sentence? Actually, the growth and division of cells in our body is controlled by 2 sets of genes. We have genes that promote and stimulate cell growth and division, and another genes which stop cell division. Why we need cell growth? Why we need cell division in our body? For growth and for healing of wounds, you know. So if we have any abnormality in the genes which stop cell growth, the cells will divide, and form a lump. This lump will compress on the normal cells around and interfere with the function of the normal cells. Also, cancer has the ability, some cells of the cancer has the ability to go in the bloodstream, to go in different organs in the body, to go to the brain, form a lump, press on the normal cells around, causing abnormalities like headache, blurring of vision, go to the liver, same, compress on normal cells and making symptoms. This is because cancer is dangerous. Not all breast tumors are malignant. I mean by malignant, cancerous. We have a long list of benign tumors, meaning by benign means non-cancerous. We have a long list of benign tumors inside the breast. So most lumps are formed by the combination of cyst and fibrosis. What is the meaning of cyst? Cyst means sac filled with fluid. And fibrosis, it's like scar tissue. These changes can cause breast swelling and pain. So if you see in here in this diagram, this fibroadenoma and this cystic changes inside the breast, it will form a lump which is painful. So why breast cancer is dangerous? Why breast cancer? Why there is awareness of breast cancer? Breast cancer is a major health problem worldwide, with an estimated 2 million new cases diagnosed per year. 1 in 8 women will have breast cancer during their lifetime. So roughly 1 every 220 women will have breast cancer in their 30s, and 1 in 68 will have breast cancer from 40 to 50 years, and 1 every 20 women will have breast cancer from 50 to 60 years. Very important to know that in males, breast cancer can happen. In 1 every 1,000 will have breast cancer during their lifetime. It's very important to know that breast cancer can happen in males. Mostly males with breast cancer will present with advanced stage because they didn't realize that breast cancer can men. Very important to know also that survival from the disease, from breast cancer, has been improving over time. And now 3 out of 4 women diagnosed with breast cancer are alive 10 years. If you see here, if any woman diagnosed with localized breast cancer, the cure rate will reach 99%, compared with distant, if the tumor is spread all over the body or any other organs outside the breast, the survival will be low. So what are the stages of breast cancer? We have stage 1 means very small tumor inside the breast. Stage 2 and 3 means breast tumor, breast cancer, and lymph nodes. And stage 4 means disease spread outside the breast. We have also stage 0. Stage 0 means abnormal cells inside the ducts in the breast. It will be like covered by a membrane, and this membrane will protect the cancer cells from going outside the breast to go to all over the body. So it's a very curable stage to diagnose this stage 0. We can diagnose stage 0 by mammogram only, and the cure is 100%. No need for any treatment except surgical excision of this abnormal cells. So what are the risk factors? Actually, we don't have direct risk factor. Direct causes of breast cancer. We have only risk factors that increase your chance of having breast cancer but doesn't cause breast cancer. We have modifiable risk factors and non-modifiable risk factors. Non-modifiables like sex, being a female is a risk factor of having breast cancer. Age, when we grow in age, getting older, the risk of breast cancer increased. Having family history of breast cancer. Family history will account for about 10 to 15% only of cases of breast cancer. So if I have 100 women with breast cancer, only 10 to 15 women will have family history, and the other will not have any family history. Early menarche and late menopause. So the duration of estrogen exposure in our body will be long, and this increases the risk of breast cancer. We have modifiable factors. Modifiable, we can modify in our life, so we can try to reduce our risk of breast cancer. Like breastfeeding. Breastfeeding reduce the risk of breast cancer. Obesity increase the risk of breast cancer. Not doing physical exercise regularly linked with high incidence of breast cancer. Alcohol use and tobacco smoking. Sure, we all know that tobacco smoking can cause a long list of cancers, and mainly breast cancers, lung cancers, prostate in males. Regarding family history, as noted, most of family history of breast cancer is the most widely recognized risk factor for breast cancer, but it only accounts for 10 to 50% only. 80% will not have family history, so they need to go for screening even without any family history of breast cancer. But having breast cancer, family history of breast cancer, it increases the lifetime risk. It will be 4 times higher if a mother or sister are affected. It will be 5 times greater if 2 family first-degree relatives with breast cancer. If any having ovarian cancer, mainly if more than 2 having ovarian or breast cancer in the family. If anyone having male with breast cancer, it increases the risk of breast cancer in the family. And genetic, what's called BRCA1 and BRCA2 mutations. As I told you in the beginning, we have genes normally stop the growth of normal cells and stop the growth of division. Mainly we have BRCA1 and BRCA2 genes, which stop the cell division. If anyone having problem in these genes, BRCA1 and BRCA2 mutations means abnormality in the genes. This abnormality can from environmental exposure to any risk factor, or inherited from the mother or father. So this will increase the lifetime risk of having breast cancer about 80%, and ovarian cancer about 40%. So if anyone having this abnormality in genes, the cancer risk will be high. So how to know about the cancer risk in any person? Recommendations that anyone having cancer, breast cancer, any diseased woman having breast cancer, she should go to do the genetic test. We have a long check of genes, mainly BRCA1 and BRCA2. If she found herself to have this BRCA1 and BRCA2 mutations, everyone in the family, her sisters, her sons, her daughters, should do the test. If you found that BRCA1 and BRCA2 mutations, there are mutations in a healthy person without breast cancer, what we will do? If anyone having this BRCA1, BRCA2 mutations and is fine without cancer, is not diagnosed with a cancer, we have like protective measures. One of the measures to protect is to remove both breasts and both ovaries. As I told you, the risk will be 80%. I mean, 80%, this person having this genetic abnormality will have breast cancer during her lifetime. So it's a big percent. To remove both breasts or both ovaries, or we will put this person under the microscope. It's like going to regular checkup, not yearly, not every year, at a short interval. We will do some tests more, not mammogram and ultrasound only. We will do MRI of the breast. So it's very important for any person should know about his family history. And also if anyone will not do this test, some women can't tolerate that they will be tested positive for genes and they are completely normal and having no cancer. We have like risk module having many like about 10 factors. I usually do this in my clinic to know the risk of this person. It depends on the family history, depends on any abnormalities in the breast, depends on the natural history of menarche, when menarche start, like this. It's a long list of factors. And by this risk module, I can know roughly what is the risk of having breast cancer during her lifetime. So it's very important if anyone having family history to know his risk, to do this risk module, to know his risk, future risk of getting breast cancer. So to be aware more if any found any abnormality in the breast, to go for regular checkup, maybe not yearly, maybe shorter than yearly in such patients, such women, not patients. So what are the signs and symptoms? All of these signs mean that the cancer may be advanced. So the aim of screening is to come to the doctor to check the breast without any signs of symptoms. So I will tell you the list, but if anyone finds this, it's, I mean, we raise the awareness of breast cancer so you can go to see the doctor to examine yourself without any of these symptoms. Sure, we all know that a lump in the breast is maybe a sign of cancer. A pain in the breast which doesn't seem to be related to the menstrual cycle. Pitting or redness of the skin of the breast. You'll find the skin like orange, like the skin of the orange. Any rash or on or around the nipple. Any swelling in the axilla. Any area of thickened skin in the breast. If any nipple discharge, and sometimes it contains blood, like here in this diagram, you will find dimpled or the breast skin, visible lump, nipple change like inversion, bloody discharge, texture changes on the skin of the breast, color changes. And as I told you, all of these symptoms may tell us that cancer is advanced already. So some women in this crowd will may have early cancer. How to detect this cancer? Screening, by screening. Breast screening means early detection of breast cancer when it is too small to see or feel. I mean, like, as I told you, without any symptoms. Also by self-awareness, monthly self-examination. Monthly self-examination is very important. So any woman will be familiar with her breast, with the sensation of the glands inside her breast. So any change or any lump, even if it will very small, she can detect it very early and go for checkup. Clinical breast examination by a doctor yearly, as I told you. Mammogram after age 40. MRI breast, as I told you, in some high-risk women having family history of breast cancer, we can go for yearly MRI. So by screening, this is the average size lump found by a woman practicing occasional breast self-exam, compared with average size lump found by a woman practicing regular breast exam. And you will find at the bottom of the list, average size lump found by getting a regular mammogram. So the difference in the sizes can be detected by clinical examination and by mammogram without any lump to feel or see. I will not go for in details about science information about treatment of breast cancer, but I want from all of you to know that we have we have advances in our treatment of breast cancer. We have many new drugs that can lead to cure from breast cancer. First, we have surgical treatment. Surgical treatment, mastectomy. Mastectomy is removal of the whole breast, and it's commonly done in women coming with a big lump. So if a woman coming with a big lump, usually we remove the whole breast. Lumpectomy. Lumpectomy means I will remove the tumor only, and I will preserve the shape of the breast. So it's very important to come early if you feel any problem in the breast, and to come for screening without any lumps, without any signs and symptoms inside the breast. So we can preserve the breast. We have chemotherapy. Chemotherapy, it's a drugs used to destroy the cancer cells. Sometimes we give this chemotherapy before surgery if you found a big lump inside the breast. So we're like trying to reduce the size of the lump inside the breast, so we can go for lumpectomy, removal only of the tumor, and to preserve the breast. It is also chemotherapy we can give after surgery in women having a higher risk of recurrence from breast cancer, like presenting with a big mass, presenting with lumps, lymph nodes, having cancer. Chemotherapy will act like it will affect rapidly dividing cells. As I told you, the cancer cells are rapidly dividing because there is no genes to stop these cells from growth. And also act on normal cells, which is rapidly growing, like GIT, like bone marrow. So the chemotherapy will act on the cancer cells, and at the same time will act on normal cells. So any woman having chemotherapy, she will experience some side effects from chemotherapy. Chemotherapy will affect the GIT, so maybe she having nausea, vomiting, diarrhea, affect the bone marrow, so there may be low immunity. Radiation therapy. Radiation therapy is local treatment. It will be local to the site of the breast only. It's adjuvant treatment for many patients after surgery. In these cases, the purpose of radiation is to kill cancer cells that may remain after surgery where the tumor was removed. So it's radiation therapy, it's like X-ray. It's an X-ray, but at a higher dose than normal X-ray. It will kill the cancer cells by inducing some inflammation in the area of the breast. We have hormonal treatments. About 60% only of cancer patients having their tumor, their cancer, love hormones. So we'll give treatments called hormonal treatments that will block the estrogen from working on the cancer cells. We have also very important treatment of breast cancer. It's called targeted therapy. Targeted therapy, it works in about 20% of patients. What about targeted therapy? Now with the advances in genetics and genomic since 2008, we now know the cancer cells more better than before. So we discovered that the cancer cells having abnormal, like these areas, abnormal projections on the surface of the cell. It's called receptors. It is the normal cells compared with cancer cells. So now we know that the cancer cells is different from the normal cells. And we have drugs that will go to kill the cancer cells only and protect the normal cells. Will not go to the normal cells. This targeted therapy will act on these projections on the surface of the cells. So now we have drugs that can go to kill the cancer cells only, no affection of the normal cells. So chance of cure will be better. Side effects, as I told you before, with chemotherapy will be much less in targeted therapy. We have a long list also of targeted therapies now approved in the treatment of breast cancer. We have immunotherapy. Immunotherapy is drugs that will boost your immunity and it will let your immune system to work against cancer. We have also approved a long list of approved drugs in the cancer breast by immunotherapeutic drugs. Very important to know that every woman with breast cancer is unique. As I told you, some women will be treated by hormonal treatment in 60% of patients. Some other will be treated by targeted only. Some other will be with chemotherapy. So every woman breast cancer is unique. It's not like each other. So don't take any recommendations or any experience from other patients with breast cancer. So what to do in normal persons, and also in during treatment of breast cancer and after treatment for survivor from breast cancer. Very important to eat healthy diet. What I mean by healthy diet, a lot of vegetables and fruits every day, at least 2.5 cups of fruits and vegetables per day. Choose 100% whole grain foods like whole grain cereals or brown rice. Limit red meat and the processed meat. Very important to limit processed meat. Processed meat contain a lot of preservatives, which leads to many types of cancers, colon cancer and breast cancer. Limit bad fats, saturated and trans fats in red meat and fried food. Eat good fats, olive oil, canola oil, nuts, avocado, all of this having very good oil. Do physical exercise regularly. Start with 10 minutes walking a day and build up. Very important physical exercise. Very important physical exercise to do, even to start with 10 minutes walking every day. And then to build up. Doing regular physical exercise regularly limit the risk of breast cancer, reduce the risk of breast cancer. Also reach or maintain a healthy weight. Very important also for every woman to go to check her body mass index, to write on Google BMI. It will give calculation to know her body mass index. If she found herself overweight or obese, to try to get a healthy weight and a normal ideal weight. Avoid smoking and alcohol. Very important. There are known risk factors for many types of cancer and breast cancer also. And thank you. Any questions regarding screening, regarding treatment, regarding risk of breast cancer? I'm with you, inshallah.
Okay, thank you so much, Dr. Suha, for the informative lecture, and we really appreciate your participation.
Thank you.
Please, anyone, if you have any question, just type it here on the chat, or you can just send it to us through our social media platforms or our emails, and we can direct it later on to Dr. Suha and share it back with you. Okay, so
Yes.
far as we don't have any question right now, I will put the certificates link on the chat box. Please enter the link, register your name and email ID, and then your certificate will be shared with you through email. Okay, Doctora, we have one question. السؤال الأول: التدخين كيف يؤثر على سرطان الثدي وأي نوع سرطان ثاني؟ So how
طبعا
most
طبعا
affects
يس التدخين مليان يعني مسببات سرطان كتير جدا. يعني السيجرت سموكر الواحده سموكينج واحده فيها a long list of carcinogenic agents. It will act like interfering with the normal division and normal growth of cells in our body. It can affect breast, can affect all head and neck area, lung cancer. يعني about 80 to 85% of cancer lung is caused by smoking. Bladder cancer, prostate cancer, colon cancer, nearly all types of cancer are affected by smoking. So the risk is very high having smoke.
Thank you, Doctora. We have another question. Can cyst turn to cancer? What size of cyst is normal is found?
Okay, cyst will not go to cancer. Okay, if purely cyst, we have something called complex cyst. Complex cyst means the cyst is not having only fluid, having same like having cells inside the cyst. This cyst, complex cyst, mainly solid and fluid, may go to cancer, but purely cyst inside the breast will not change to cancer. We have nothing. We have not normal size cyst. Cyst is abnormal, but this abnormality is good. It's nothing to worry about cyst.
Okay, thank you, doctor. Another question. Can you please just give us more details about how the healthy food and maintaining a healthy weight can affect breast cancer, or especially in preventing breast cancer?
Yes. Regarding weight, in obese patients having a lot of fats, this fat sometimes like it's related to the bulk of fat in our body. Some fat will make, I will explain it simply. Some fat will raise and will release in the blood like some inflammatory factors, and these inflammatory factors will go to affect the normal cells. So if we have a bulk fat in our body, some will make like inflammation in cells, and this inflammation in the cells, it's like irritation of the normal cells. You know, if you have like inflamed area, irritation, so the growth of cells will be more rapid in this area, and it can be a risk factor of cancer. So it's the same. That fat will release some inflammatory products inside the blood. It will go to affect the cells in the breast and making it rapidly growing, rapidly dividing, and this is a risk factor for breast cancer. Healthy diet, sure. Eating a lot of fruits and vegetables will contain um, minerals, vitamins, will contain free radicals, will contain antioxidants. Sorry, antioxidant will act on free radicals in our body. Free radicals is like toxins in our body. It will irritate the cells, making it more dividing. So antioxidants in fruits and vegetables will be against these free radicals in our body. So it's very important to eat healthy diet, fruits and vegetables.
Thank you so much, Dr. Suha. Zuleika Hospital is offering free screenings, and you can book your free appointment with them. Just call the number mentioned in the chat box. Also, please follow Pink Caravan social media accounts to have more details about our next webinars and our next public activations, where we also provide free examinations and screenings. Thank you all for joining us today. Thank you so much for your time, and looking forward to have you again on board, all of you, in our next webinar next week. Have a lovely weekend. Take care and stay safe.
Thank you so much. Thank you.
العافية دكتورة، وشكرا جزيلا لوقتك.
العفو.